definitely gone out the window. Thank you. The high and low functioning labels have definitely gone out the window. And I think one of the reasons is not only that it's a pretty offensive term to those that we would term low functioning, but also that it's not really clear on what components of functioning we're talking about. And instead, people really prefer if you describe the specific characteristics of the sample we're talking about. So often when we're talking about functioning, we're talking about some level of cognition or intellectual impairment. So just specifying, the average or above average IQ population or population without cognitive impairment, something like that would be more clear and perhaps less offensive. There's also a huge buck to anything that talks about treating or curing autism. Definitely this community can get talking about eugenics when they see that kind of language, that you're basically trying to erase this important characteristic that's part of their identity. Instead, people would prefer research that's on supporting autistic people to live their best lives and to have the highest quality of life that they can. And that's a pretty consistent message from this community. Along those lines, many of us are familiar with applied behavioral analysis, or ABA, as a pretty common and well-respected, I've perceived, intervention for autism. And that's something that most adults that I've talked to will tell you were traumatic for them. So really, when we're talking about anything that's made to make an autistic person look less autistic, we're trying to minimize their true experience and instead paint this picture that they blend in and let's hide those traits. And people have viewed that as deeply unsettling, and it also minimizes their ability to naturally cope in the ways that they've formed for themselves. Instead, they prefer treatments. I'm sorry, that's not what they prefer. Therapies such as physical therapy, occupational therapy, speech therapy, or augmentative or alternative communication. So just looking again at that Autism Speaks flyer that I showed before, I wanted to point out a couple of the things that people really don't like about Autism Speaks, and not to pick on them, but they're sort of an easy one to find resources in the autism community about people not liking the work that they're doing. And one of the big reasons I think is when we're looking at research and we're looking at funding dollars, kind of the easiest way to make our case is to paint this picture that people are suffering and that people are really having a hard time and we need to help them. And the autistic community's message has consistently been, we're not suffering. Any suffering that we're doing is a lack of acceptance and creation of these social barriers, that if you could just minimize the barriers and help us manage these other factors, we would be in a really good spot. So really these images of autism that paint it as, that autism is on the rise and it's scary and we need to control that, are things that increase stigma and create barriers towards acceptance of this community. This I found really interesting, that people are upset that Autism Speaks funds research that looks at causes of autism. So I think many of us in the research community would be interested in the causes of autism and looking at any genetics involved and how these things work. And in this community, what they're saying is that you're wasting your money on that. We shouldn't be trying to prevent autism from occurring. Instead, we should be looking at making life better for those of us who are autistic and bring important things to the world. So looking at this medically based definition of autism, obviously this is a pretty deficit-based model. Just looking at the words, they all kind of begin with deficit. But just to get us on the same page about what is autism spectrum disorder as defined in the DSM-5, we're looking at persistent deficits in social communication and social interaction. So a lot of people struggle with social emotional reciprocity. They may struggle with back and forth communication. They may overshare or undershare things with other people. We're also looking at deficits in nonverbal communication behaviors. So eye contact is one that stands out to a lot of people, that often people don't make eye contact when they're on the spectrum. And we can train people to make eye contact using things like ABA, but this isn't a natural or comfortable state for most autistic people. Deficits in developing, maintaining, and understanding relationships. I think those of us who've worked with people on the spectrum would say that it's not always that they don't want to have social relationships, but often have a hard time fitting in or learning how to start up those friendships or have that back and forth kind of relationship. A lot of people have a hard time adjusting their tone maybe depending on the setting that they're in. So they may be at home and speaking in a very professional voice, or vice versa. Somebody may speak very casually at work and not always understand how to come off as a professional in the workplace. We're also looking at restrictive and repetitive patterns of behavior, interest, or activities. So a lot of times this looks like really rigid routines. A lot of people also do repetitive motor movements. So we see a lot of hand flapping in kids. A lot of adults adapt this to be things like rubbing their fingers, maybe even inside their pocket. They may be doing some kind of motor movement like that. We also do see a lot of hyper, or it can be hypo reactivity. I will say in what I've seen, it's usually hyper reactivity of sensory input. So they may be in a room and you may be talking to them and they may be distracted by a light that's blinking or a high-pitched noise or a pattern on a carpet that I might not be picking up on, but to them, it's hard to block those things out and to focus on what I'm talking about. Switching to a little bit different way of looking at autism, this is, I would call this an oldie but goodie. This is a 1999 definition of autism by Atwood and Gray. And basically what they've done is take those characteristics of autism and flip the switch. Talked about these as, in this part, even a qualitative advantage in social interaction. So starting to look at, for example, that they have absolute loyalty in a lot of their relationships, that these things can really come with advantages and benefits, and not just looking at it through a deficit-based lens. I think the second one in this A category is especially interesting when we're talking about queer identity. So we often see people who are free of sexist, ageist, or culturalist biases. And just considering, how does this influence gender and sexual identity and expression in this population? So I think a lot of gender is culturally and societally taught and not inherent. And when people are living outside of those cultural biases, it can open new doors to how we look at gender and sexuality. So there are a lot of definitions like this out there. This would have gone along with the Asperger criteria and not autism spectrum disorder on the whole. But things like the Autism Self-Advocacy Network has their own strengths-based definition of autism, things like that out there. And I think these can be really helpful to give to people, especially adults who are discovering autism in adulthood, to help them become more self-aware and self-accepting and self-loving, and realizing the strengths that this can bring to them. The most recent statistics, 1 in 54 children are identified as autistic. Boys are 4 times more likely than girls to be identified. I think there's a lot of interesting research out there now on whether that's related to the actual prevalence of autism, or whether that's just what we're looking for. I like to relate it to heart attacks, that we used to always be looking for left arm pain and chest pressure. And in women, we were missing that they tend to have these GI symptoms and GI upset when they're having heart attacks. And so we were missing the precursors to heart attacks in women for years. I have to wonder if autism is heading in a similar direction. There's been a lot of work lately on the female phenotype of autism, and females tend to have more internalized symptoms. So a lot more of that depression and anxiety that go along with this social component, but they tend to be able to camouflage those behaviors a little bit more so that somebody wouldn't pick up on their cues as quickly if they were trying to identify them. Experts do estimate that for every 3 diagnosed cases, there are 2 additional undiagnosed cases. We're especially seeing this in middle-aged adults and even older adults who autism wasn't a thing when they were kids and they had no idea. And now we have a lot of parents, especially, who bring their child in and the child is identified as autistic, and then the parent starts to recognize, hey, I have a lot of these traits, or my partner has a lot of these traits. So it's been a growing trend to have these adult diagnoses. And that's where I started my research, was looking at people who were diagnosed in adulthood who discovered that autism identity when they were 30 or 50 or 70 years old. And so one of the first big studies that I had done was a mixed method study, and I was looking at barriers to getting a formal diagnosis of autism in adults. And you can see I've updated language in the last few years, so there's a lot of deficit-based language in some of these studies. But what I was shocked to find is I had just collected some demographic information about gender and sexuality. And what I found was that 28.6% of this sample, which was it was over 600 people. And these were all people who identified as autistic. And this percent of them identified as a gender other than male or female. So agender, genderqueer, transgender, unsure, questioning. And nearly 70% identified as a sexual orientation other than heterosexual. So I was immediately really intrigued. And at the time, there wasn't a whole lot out there talking about this and looking at what is this like for people to identify, kind of as this double minority. So as they're formulating their identity, these are people who weren't aware of their autism in childhood by nature of the study. And then on top of it, they have a queer identity that they're trying to sort out with this neurodivergent identity. So really quickly, I think many of us are up to date on our lingo already about gender and sex and sexual orientation, but it just warrants review when we're talking about this. That when I'm talking about LGBTQIA+ population, I'm talking about people who identify as lesbian, gay, bisexual, transgender, queer, questioning, intersex, agender, asexual, and any other sexuality that people identify. I would say I'm not talking about allies. I'm not talking about people who identify as cisgendered and people who identify as heterosexual, both of those. So basically, to clarify terms in this particular study I'm going to talk about today, I'm only looking at sexual minorities. So I'm only looking at who people are physically, emotionally, sexually attracted to, not how they identify and whether their gender, if their sex assigned at birth matches their gender identity. So the previous research looking at this intersection of populations, basically, these are based on some big studies in Sweden and the Netherlands, and they found that 10 to 13% of the neurotypical population identified as sexual minorities. That's a lot higher than what we're seeing in the United States. The most recent stat that I saw in the US was 5.6 of the US population identifies as a sexual minority. But for the sake of comparison in these big studies, this was their neurotypical population. In the autistic population, they were seeing anywhere from 18 to 44% identify as sexual minorities. So a lot higher than the general population. And what we can see from the previous research is that there are a lot of physical health disparities that both of these communities are independently at higher risk for. So we do see increased risk for diabetes, cancer, cardiovascular disease in LGBTQIA folks compared to the straight population. And then in the autistic community, most physical disparities that you can think of, people tend to be at higher risk for. So especially obesity, hypertension, diabetes, gastrointestinal disorders, seizure disorders, compared to the neurotypical population. In addition, we're looking at much higher risks for mental health disparities. So approximately 27% of autistics have a current anxiety disorder, and 23% have a current depressive disorder. And that's compared to an estimated 1 to 12% in the neurotypical population. Autistics are also approximately 9 times more likely to experience suicidal ideation and 5 times more likely to attempt suicide than the neurotypical population. So when we're looking at that as just being the risk of suicide risk in the autistic population, and then we're looking at an increased risk for suicidality as well in the LGBTQIA population, we're looking at a pretty high risk group for mental health co-occurring conditions. In addition, we have limited healthcare access in both groups. Both of these communities talk about being discriminated by healthcare providers, and that being a huge barrier to care for them. And then there are some other more physical barriers as well. For example, in the autistic population, a lot of people talk about the social anxiety of making a healthcare appointment, or the sensory experience of sitting in a waiting room can be really a huge barrier to them seeking care. So we have all these healthcare concerns, and then we have limited access to healthcare resources. We also have other risks like being bullied, risk for physical abuse, risk for sexual victimization, violence, and abuse. Both of these populations are at higher risk for those as well. So essentially, where these two populations meet, we're looking at a really high-risk community. Excuse me. We also live in a heteronormative and neurotypical normative culture. So that comes with its own challenges for this community that are living in this double minority population. So again, all of that sounds very scary and deficit-based, I would say. And what the research that I do is primarily qualitative research. And one of the things I love about qualitative research is that it really gives voice to the population. So if the population says, yeah, we have these really big concerns, then that's what we can focus on. And if the population says, yeah, these are some challenges, but look at these strengths, then we can shift in that direction as well. And I just love this quote: qualitative research can put the flesh on the bones of quantitative results. In qualitative research in general, we're looking at a humanistic approach. It offers a way of seeing and understanding being and experience. So there have been a lot of calls by experts to explore this queer autism identity intersection through a qualitative lens. When I first did the study I'm going to speak about today, there were a few others out there. There were 3 out there that looked at this intersection. 2 of the studies focused only on gender minorities and didn't look at sexual minority at all. The 3rd study did look at the sexual minority experience, but only in adolescents and young adults. So their population was limited to 12 to 20-year-olds. And what these studies that were previously done did find, all 3 of them talked about this as being a double minority population that was basically disempowered in multiple ways. They also addressed the fact that there are these compounded health disparities that we've already talked about. And many participants in one of these studies opted not to disclose their identity to providers, which I think is a little bit scary when we think about things that providers need to know that can help us do the jobs that we do. It is a little frightening to think that people wouldn't disclose to a provider if they were in if they identified in a way that could potentially increase their risk for certain health disparities. We want to be that safe place where people can share those things with us so that we can help navigate some of the barriers they may face. A lot of people talked about feeling othered and isolated. People talked about especially being isolated from the LGBTQ community if they identified as autistic, because of a lot of misperceptions about autism by the general public. A lot of people also talked about their gender and sexual identities being invalidated by people that they talked to. So a lot of people were told that their gender identity was solely just, they were confused, that their autism had sort of clouded their ability to recognize their own gender or sexual identity. And that was a pretty invalidating experience for people who were already really struggling with how to kind of own and assert their sexuality. So the purpose of the study that I did was to explore the lived experience of identifying as autistic and as gay, lesbian, bisexual, asexual, or other sexual minority orientation. The method that I used for the study that I'm going to talk about today was something called descriptive phenomenology. This is basically a method that helps us try to look at truth from the lens of the person who's living the experience. So we try and set aside any researcher bias and to really let the population tell us what is it like to live in this way without our own interpretation. We try and set aside our presuppositions, and that kind of ringing true to that truth is in the eye of the beholder. So I recruited a purposive sample of autistic adults who identified as sexual minorities for this study. Basically, we put out there some notices that I'll talk about in a minute and let people self-identify and tell us if you identify in this way, whether that's self-diagnosed, whether you're questioning your sexuality still, whatever that might look like for any individual. They were basically could self-select to be in the study. So our sample, we had 67 individuals in the study overall. Large percentage of females. So again, boys are 4 times more likely to be diagnosed than girls in childhood. I think it really stands out when we're looking at these adult populations. I'll tell you consistently, the studies that I've done have had a lot higher representation of females than is traditional when we're looking at kids studies. It could just be that they're more active in the online spaces, but I have to think there's something to this, that a lot of women are coming to this diagnosis and identity later in life. Most were formally evaluated and diagnosed as autistic, but we did include, again, self-diagnosed people and people who were told they were probably autistic, but hadn't been able to get that formal evaluation for one reason or another. Our largest representation was from folks who identified as asexual, and we also had a lot of people who identified as gay, lesbian, bisexual, and pansexual. It's also worth noting that I asked people, we had sort of a close-ended question to say, like, select your sexual orientation. And then we also asked people in an open-ended way to describe their sexual orientation. So later on, when I start talking about people's individual experiences, I'll use the terms that they tended to use instead of just clumping them into those bigger categories. There were 14 countries represented in this sample. Most individuals were from the United States, Australia, UK, and Canada. Obviously, there is a really big cultural component when we're looking at sexual orientation in general, and how things are accepted or not accepted in certain cultures definitely have an impact on people's experiences. We did not explore that in this study, which is certainly a limitation. But I will also say that there weren't any clear trends that were coming out from the samples that we interviewed and talked to. We recruited participants from online forums and message boards. So if you go on really any social media space, there tend to be different groupings and people kind of coming together with common interests. And there are a ton of these out there for autism. So we were on some Facebook groups. Reddit is a really popular one. Twainbo is an organization specifically for autistics who identify as LGBTQ. Wrong Planet is an online space made for and by autistics. So we posted recruitment notices on these message boards, and basically it sent people to our study website. And then we started doing our asynchronous online interviews. So basically, we would ask people some open-ended questions on a survey style tool. We had them answer the questions, and then they had the option whether or not they wanted to provide us with an email address for follow-up questions. So we did allow people to remain totally anonymous if they wanted to. Most people opted to give us their email address and allow us to ask follow-up questions. And if they did have follow-up questions, we did not email them directly for their privacy and confidentiality. We basically created a new survey tool that was unique to them. And we asked them basically, like, in your last response, you mentioned, and we'd share part of their quote, can you tell us more about that? Or we'd ask a probing question to get more information about what they shared with us. And so we would put all that in a new survey tool and then email them the link to their unique survey. And that was just kind of a workaround to be able to protect people's confidentiality while still getting them to participate in these back and forth written conversations. We did choose to do written interviews using these survey tools instead of face-to-face or Zoom or phone interviews. Studies have shown that this can decrease the emotional and time and social pressure of a conversation for somebody who might have social anxiety, which is really common in autistic individuals. And what this did is really allowed them to take their time in responding to us. And this approach has been shown to increase people's comprehension of the questions that you're asking them and their sense of control over the conversation. So this is just one of the main questions that we asked people in that first broad open-ended survey. What has been your experience as an autistic individual who identifies as a sexual minority? Please share any thoughts, feelings, and specific experiences in as much detail as possible. And we did have some intro parts that talked about what we were talking about when we use the term sexual minority, how we were using the term autistic individual and who would be eligible essentially. And we continued to collect that data until we reached saturation. What was interesting about this study is that we kind of took off and got a really big response right away. So we hit saturation probably around 35 to 40 responses, but 67 people had participated before we even realized that we had reached saturation. It sort of took off in 2 weeks. And so we closed down the survey, but anybody who had participated, we still included their information in the final analysis as well. For our analytic approach, we use Kalasi's method for descriptive phenomenology. Essentially, this is a thematic analysis. So we took statements that people had talked about the phenomenon of interest, anything that we deemed as significant, and we clustered those into themes. Ultimately, that brought us to an exhaustive description of the phenomenon. So that included anything that people had talked about as being really relevant to the experience. And then the fundamental structure of the phenomenon was a really concise statement saying, these are the ubiquitous characteristics of the experience for people. And then the most important part, I think, of this method is returning to the participants, sharing those findings with them, and asking them for their feedback. So we had 10 participants who reviewed our findings and helped us refine the final analysis. So ultimately, we came up with 6 themes that captured the experience of identifying as autistic and as queer. And I'm going to go through those and share some quotes from participants. So in qualitative research, our data are our quotes. So I'll share what these experiences looked like for people. So the first theme was that self-acceptance is a multi-layered journey. For individuals who reached a point of self-acceptance, they talked about this journey including layers of self-exploration, self-forgiving, seeking approval from others, and then ultimately, hopefully, embracing their identity regardless of what other people thought and whether or not they were accepted by their family or their peers. One person shared, "My self-identity is a fluid and flexible thing that can evolve the moment I realize something else about myself. That's how it has always been with me. I'm not a rock so much as a tree." And that was somebody who identified as female and non-binary and asexual. A lot of people talked about dealing with shame. Somebody said, "Both autism and my sexual orientation brought intense shame." And somebody else said, "I'm not very comfortable with it to the point where I do not wish to label myself. My parents are not accepting either. As a result, I'm ashamed of who I am and I deal with internal homophobia." And this was somebody who identified as female, attracted to other females. Other people recognized and accepted autism and sexual. A lot of the time when people were talking about their autism and sexual identity, they talked about these as 2 separate components of their identity that required them to sort of explore and question before they really formulated it as part of their identity. Some people talked about being really comfortable with one component, either the autism or their sexual orientation, but not at the point yet where they were comfortable with their holistic identity. And this was often a very long journey for people. Somebody said, "I was intensely uncomfortable with myself, obsessively ruminating over my sense of self. That started at an early age, but got much worse at puberty and didn't stop until I accepted both my Asperger's and gender dysphoria." And this was somebody who identified as a transgender girl and pansexual. Other people, interestingly, really saw this as a matter of fact. They said, "This is just something about me and I don't give it a lot of thought." Somebody said, "I already have to spend so much energy every day trying to make sense of the world. Why would I waste it on internal discord over something about me that is unchangeable? For me, being on the spectrum and being a lesbian is no different than having brown eyes. It's something I was born with, and it's just part of who I am." For a lot of people, they also talked about feeling unsafe in embracing their identity, and that could be their autistic and or their sexual identity. People talked about fearing that they would be physically hurt by family members. People, when they talked about autism, would say, they're going to say that I'm full of it if I come out and tell them, "Hey, mom, it turns out I'm autistic." They were saying there's no chance their family members would believe them or allow them really to embrace that as part of their identity. The second theme that came up was autism complicates understanding of sexual identity. So people talked about questioning the relationship between autism and sexual identity. Many felt that their autism had delayed or complicated their understanding of their own identity. So somebody said, "I think my autism significantly increased my initial confusion." And another said, "I also think that being autistic might be part of the reason it took me so long to realize I was queer." They also described challenges recognizing their own emotions, which is pretty common in autism in general, which also made it difficult for them to recognize when they were attracted to somebody. So they couldn't quite tell what that feeling was. They wondered, is this friendship? Is this something different than friendship? And struggled with that piece of it. Others felt that their autism had limited their participation in social interactions, and that really complicated their ability to explore their sexuality. Somebody said, "My extreme difficulty in relating to others and in forming relationships with others has been a pretty thorough barrier to understanding my sexuality. It's difficult to examine one's own preferences when you spend the vast majority of your life as a spectator, viewing romantic relationships from the outside." And that was somebody who identified as male and pansexual. Some felt that they never had the opportunity to confirm that sexual orientation. So for example, one participant talked about wondering if she was lesbian or asexual and said, "I really won't know until I'm in a position to have sex." And that was something that people felt limited their own feeling of owning an identity. Others felt that their lack of relationship experience made their sexual identity what they called irrelevant. Somebody said, "Since I've never been anywhere close to having a partner, my sexual orientation is irrelevant." That person identified as male and as homosexual. But it was interesting to see how they sort of owned or disowned that component of their identity. Some also wondered if autism affected their sexual identity more directly, particularly for those who were asexual. So somebody said, I feel that my aromantic identity may have something to do with my autism. Not wanting to be in a romantic relationship is at least partly linked to me not wanting to be stuck in an intense, regular relationship like that. I like to be able to escape when I need to. And that was somebody who was identified as female, asexual, aromantic. Most people, though, denied this connection and felt that really they had a totally separate autism identity and sexual orientation, and that those things were not related. And people actually resented and felt illegitimized when people associated those two things together. So somebody said, I think a lot of people feel like my asexuality is just because I lack experience, or it's just because I'm antisocial as a result of autism. So they still want to fix me. And that's somebody who identified as agender and asexual. Another said, people often think that my lack of interest in sex is due to my Asperger's and will not listen when I explain to them that this is not the case, making it harder to present asexuality as a legitimate orientation. The third theme was looking at anxiety, sensory overload, and social stressors and the ways that those affected sexual expression. People talked about how they became pretty uncomfortable in sexual encounters for different reasons that they related to their autism. Many described genitals and intercourse in general as gross, disgusting, and repulsive. Somebody said, I think genitals of all kinds are pretty gross. I have a sex drive and I masturbate frequently, but I think of it as a third way of going to the bathroom. It's somewhat contradictory, and that's made it confusing. Sex to me is an abstract concept rather than something that people actually do. I don't think that I could actually go through with it outside of my head. I wouldn't even react physically. I strongly suspect it would be a foreign and uncomfortable experience, like getting an intrusive physical from a doctor. I think the root cause of all of this is rooted in the hypersensitivity of autism. That hypersensitivity often made intimacy a challenge for people. Somebody said, I also find it challenging when some of my sensory issues raise their heads. Some things just gross me out, and it sucked when I was dating a girl and her touching me, even leaning against me, set off my sensory issues regarding hygiene and other people's icky body stuff touching me. Trying to figure the sensory response out, feeling guilty, trying to make it go away, it was really emotionally difficult. People also talked about hygiene being a pretty common issue. They talked about being bothered by people's smells in particular, but really anything that helped them, that was related to cleanliness, bothered a lot of people. Somebody said hygiene comes into play quite a lot in my mind because I have challenges and needs surrounding the cleanliness I expect in people that I'm going to be physically close to. I'm highly turned off by a person smelling like they're not clean. And if and when that's been the case, it's turned me off faster than virtually anything. And I'm not speaking of genital regions. It's more of an overall sense of good hygiene. If people have body odor, their hair smells dirty, their teeth appear dirty, or they smell like food or smoke, anything like that, it's too much for me. And that was somebody who identified as female and lesbian. Anxiety could also be a really big issue. A lot of people talked about feeling very self-conscious in sexual situations, and that really made it entirely unenjoyable for them. And that ultimately affected their expression of their sexuality. And all of these challenges were further complicated by issues communicating with their partners. So, for example, somebody said, I've recently been aware that during sex, I do have issues with my overall performance due to my inability to communicate clearly enough and some degree of sensory input. That is, too much or too little stimulation is a fairly hard line to say just in between. People also talked about feeling on the outskirts, feeling misunderstood and misunderstanding others. A lot used the phrase double minority, and they described that they felt excluded from both the LGBTQ community and the autism community. Somebody said there's such a sense of community among those who identify as being LGBT unless you're on the spectrum. Being on the spectrum makes it difficult to form meaningful connections with others. And as an individual who also identifies as a sexual minority, it further isolates you. You're isolated by not only your brain wiring, but also by the hard wiring of the social constructs of society. And that was somebody who identified as female and lesbian. People also talked about feeling left out of the social experience and the sort of the broader experience of puberty and growing up and being in a relationship. Somebody said, forming meaningful, lasting relationships is hard enough when you're on the spectrum because you miss so much of the unsaid world around you, the societal expectations you never picked up, the physically expressed emotions and desires. When you add on being a sexual minority, you're also often missing out on some of the classic growing up experiences that help people bond together by virtue of your relationship being different as well. As a cisgendered woman who's attracted to other women, you can't reminisce with your friends about the first time you kissed a boy, because for you, it's all about the first time you kissed a girl, and they don't want to hear about that experience generally. It's hard enough trying to help people understand being on the spectrum, but when you add in different sexual orientation too, it takes incredibly empathetic people to see beyond the differences and see the person to form a relationship with them. People also talked about not understanding cultural norms. One of the really interesting coping mechanisms that a lot of people on the spectrum use is observing other people's social behaviors and then camouflaging by mirroring some of those behaviors. So for example, there are some funny comedy sketches out there by autistic men who talk about, watching rom-coms to learn how to be the boyfriend, that kind of thing. And people that use this mirroring as a coping mechanism talked about not having these role models and cultural norms to base their relationship behaviors on. So somebody talked about, I don't really know what is the thing to do or the way that it's done, especially in queer dating, because examples of it aren't even shown on TV or universally present in popular culture the way heterosexual dating is. I had to Google how to behave on a date with a fellow woman. Somebody else said, I was always attracted to females as well as males, but it's hard for me to connect to females socially. I learned social behavior through copying, and I don't know how to flirt with women. The fourth theme was looking at concerns about the ability to find mutually satisfying relationships. People talked about having difficulty making friendships, and that really made them feel like relationships beyond that were outside of their capabilities. Somebody said, in my experience, I find it very hard to make and keep genuine friends. So friendship is both something I really treasure, but also something I'm weary of, as it feels like it will eventually go wrong, as it has every other time. People also talked about having a really hard time reading people's intentions, telling if somebody was being genuine or understanding if they were being taken advantage of. They also felt that if they found somebody who was interested, they had this hard time with, especially participants who identified as asexual, that will I be able to meet that person's emotional and physical needs? Somebody said the majority of people I've been interested in are not asexual, leaving me wondering if getting into a relationship with them, I'd be neglecting their sexual desires. I do not wish to leave a significant other in a tight or awkward position because of my own sexuality. I'm growing increasingly worried about the future of my potential relationships. The final theme was looking at ability to recognize and effectively communicate their intimate desires. A lot of people talked about just not having the communication skills or the confidence to talk about this with partners. And they also struggle with identifying their own desires and feelings. So somebody said, being on the spectrum, it's hard enough to readily identify my own feelings in a given situation, let alone articulate them to someone else in a meaningful manner. And somebody else said, I don't know how to explain what I need. I also have a lot of issues interpersonally as far as communication is concerned. Even with someone I consider myself exceptionally emotionally intimate with, I can't seem to pull the emotions out of my words, and things inevitably come out sideways. Excuse me. An additional challenge for people was this need to double disclose their identity that also required a certain level of confidence and communication skill. Somebody said, when meeting guys, I feel as if I not only have to try and explain how differently I think, but I also have to explain the fact that I don't like sex. And that was a male who identified as asexual homoromantic. They also had challenges perceiving how others would respond to disclosure, whether they were in a safe place to come out to somebody or not. And they also struggled with how to respond to homophobic comments and discrimination from others. So looking at some of the implications of this, I think first of all, it just gives some insight into the experience that people are living in and how they perceive that identity formation in themselves. But I think it also highlights a lot of the complex mental work that people are doing through this identity formation period, especially that isn't just in adolescence, but for many of these individuals lasted well into adulthood. Participants talked about feeling shame, depression, anxiety, confusion, self-doubt, and self-consciousness. And all of these have obvious impacts for mental and physical aspects of relationships. Our asexual participants particularly talked about some unique fears about not meeting a partner's needs. And that complicated their drive to find these relationships and to find mutually satisfying relationships. There are a lot of aspects of this that clearly require more support as people sort through their own identity, recognizing their own identity. They also talked about feeling some issues with physical performance during sex related to anxiety and depression. And so getting help in these areas and counseling for these other mental health components might help with their ability to find satisfying sexual relationships. We also know that this population is at increased risk for sexual abuse. That's been shown in a lot of studies, both in LGBTQ communities and the autism community. And I think this study helps us see some of the potential causes for that are happening in this community in general, some of the risks that this community might have. So talking about struggling to read social and sexual cues, questioning whether relationships were genuine, struggling to communicate their own preferences and wishes for sexual relationships. I think all of these threaten people's ability to detect sexual predatory behavior and potentially to rebuff somebody's advances if they're not interested. And when we look at somebody having that confidence and communication skill to say no and set their boundaries, that can certainly be a challenge in this population that could potentially put them at higher risk of being abused and victimized. We also need to provide explicit education on safe sex practices, particularly for same-sex intercourse. So people who can't get pregnant might not recognize that they need to use birth control. I think we're generally aware of that, but looking at this population in particular, a lot of the past research has shown that sexual education is often impractical and not helpful for this population. They tend to have lower levels of perceived and actual sexual knowledge, and ways that we can boost that and tailor programs to their needs, I think are really important at this point. And when we think about sex ed in this community, it's not just safe sex. And I think a lot of the potential topics for sexual education came out in looking at some of these themes. So for example, looking at courtship behaviors, looking at how we interpret sexual cues and language, coming out to safe people in safe spaces is definitely something that needs to be clearly discussed with this community. How to respond to homophobia and discrimination. And then also looking at some of the practical challenges with things like sensory overload and hygiene during sexual encounters. So how to clearly communicate your needs to a partner about your hygiene preferences. Maybe that's something like having sex in a familiar environment so that there aren't additional new smells and sights and sounds that could potentially make this a more challenging experience. And then again, more practical, even that role-playing kind of communication practice for them about how to set sexual boundaries. We also need to be really mindful of our language, especially language that could potentially invalidate sexual identity. So I think from hearing from these participants, many of them shared with me that their providers had said to them that, oh yeah, you identify as asexual, it's because you're autistic. And a lot of them found that really offensive and challenging. So recognizing that it might be helpful for people to know that there is a higher rate of people who identify as LGBTQ in the autism community, but that cause and effect type relationship should not be implied and can be really illegitimizing to a lot of people. And then looking at helping people build connections in the autism and LGBTQ spaces, especially finding communities that are really tailored to this double minority community of the autism and LGBTQ community. These can create not only a sense of support and belonging for people, but in addition might give them some of that space to observe how other people are interacting and model some of the behavior if they are interested in pursuing a relationship, but just need some role modeling of how that's done in the queer community. With that in mind, this is a totally different study I've been working on lately, is looking at neuromixed relationships and outside of the queer community altogether, looking at when one partner is neurotypical and the other partner is autistic. And one thing that I've found that I find frightening and just want to get the word out and share is that a lot of these online spaces that say that they're support groups for partners of autistic people have very toxic and pathological views of autism that get shared and spread very quickly in these groups. So I have a quote here from somebody who's a leader of a peer-led online space like one of these. It's not one of these, but she shared with me in an email back and forth on this study. Most Asperger's males look for a nice, pleasant, happy, outgoing female to replace their mom, just another caregiver. The actor soon loses his wonderful person persona soon after he's hooked up with the unsuspecting female. It's all downhill for the non-autistic partner. She loses her self-esteem, her self-confidence, her place in society because her Asperger's spouse refuses to mingle with others. Soon she's a mere shell of who she was before. We do not believe that neurodiverse relationships can be successful. Over the past 20 years, we've only heard from a handful of happy neurotypicals, and possibly they were also on the spectrum. And that's coming from a leader of a community that says that they're a support group for partners of autistics. So just being really, really mindful of the spaces where we are directing people. I firmly believe that a lot of these groups can actually be very toxic to relationships. I'm not going to get into the limitations of the study just for the sake of time and wanting to be able to fit in some questions. And I just want to share a couple future directions that I'm heading with this work. One is looking at the coming out experience and the disclosure experience for autistics who identify as queer. I'm also interested in looking at generational experiences of identity formation for people who grew up knowing that they were autistic versus people who discovered an autism identity later in life. I ultimately would love to be involved in and help create a educational intervention made by and for autistics looking at sexuality and sexual health in general, but also the mental health and courtship components of sexuality. And finally, the clear direction that I think we need to be heading is research that's co-led by autistics to help us stay on track with the tone and the voice that we're using, and making sure that this, that the community-based and participatory-based action research, that the benefits are really clear. And I think that needs to be where we take this with next steps. And I'll end there for hopefully a little bit of time for some questions.
Well, thank you very much, Dr. Lewis. That was a wonderful talk. So much to think about. I'll invite the audience. You can want to put on your video and ask questions. You could put it in the chat and I'll read the chat to Dr. Lewis. We'll see how it goes.
Excuse me.
I was wondering, when you were talking about autistic people not appreciating research into curing or treatment of autism, is this a sentiment felt across the spectrum, or is this the higher functioning end of the spectrum speaking for everyone?
That's a great question. I tend to work with the higher functioning is definitely not a term they would like to use, but I think we kind of know what we're talking about with that group. That's the community I tend to work with, and they are very loud voices in the community. That is absolutely the sentiment of that part of the community. I think it's harder to capture the voices of people who are more on the lower functioning end of that spectrum. And I think a lot of the time what we end up hearing are the voices of their parents or caregivers. And those voices, I would say, have a really strong message in opposition to that. So I think the parent community and the caregiver community are certainly not opposed to cure-based research and treatment-based research. And I haven't heard autistic voices on that side. The autistic voices I've heard have been clear, but I think it's hard when we basically are looking at people who might be nonverbal. They might need somebody else to speak on their behalf. And now we've sort of ruled out this community as being illegitimate if you're a parent or a caregiver because you're not autistic yourself, when actually they're advocating on behalf of somebody who that person is their voice right now in the bigger conversation. So it's certainly split. It's a highly controversial. It's hard to say anything right now, to be honest with you, without putting your foot in it and upsetting part of the community.
Here is something in the chat, I think from Jeremiah. It says, thank you for a wonderful presentation. Your humility around your research is quite refreshing. Have you come across any good resources for sex ed for autistic teens, books or websites, anything?
Yeah, there's a really good thing out there right now. That's the OAR, the Organization for Autism Research. They have a sexuality module that I've come across that I think is really pretty good. And I can send that. I don't know, Julie, if I can send that to you to circulate after this. But if you look at OAR and sexuality and autism, it would probably come up if you just Google it. They have a really great resource that was from a funded study of theirs. Somebody created this module. I would say it's tailored more towards heterosexual individuals. So might not capture people who are exploring a different gender identity or sexual orientation, but they do have, it's like one or two of their slides focus on coming out and exploring your sexuality. But in general, there's a lot on courtship and just social relationships as it relates to autism and sex ed, basically.
If you want to send it to me, folks can ask, I'll send it to folks who ask for it.
Perfect, thank you.
Thank you. Or you can Google it. Let me ask a question. I'm interested in the sort of, I study older adults. I'm interested in the sort of aging, story. Is there, I mean, it sounds like your research is in adults, obviously. What do we know about, just older adults with autism? It's sort of, or autistic adults, excuse me. I'm interested to sort of think about how that interacts with all the sort of, and the identity formation at this later age, it's all very interesting. I don't know what to think about it.
Yeah, it's a really great question, and one that we're there's no research that I've seen really looking at the older adult experience of autism in kind of the broader ways. I'll tell you anecdotally, I have a couple of older adults that I'm in close contact with who discovered autism at age 65 and 68. I think the two of them did, and it's been fascinating just being a part of their journeys. They kind of came to autism around the same time that I did. And so we've kind of been aging together in this process. And what's been really interesting, especially I would say, is one of them is recently retired. And he's finding that in some ways that's been great to take off his plate all of these social concerns and things that had caused him a lot of stress in his life. But he's also becoming much more reclusive. And a lot of autistics talk about, like in kids, we talk about meltdowns a lot of the time. And in adults more often, I would say, we see something that a lot of them call shutdowns, where it's a much more internalized experience and they really close themselves off to the world and just internalize a lot of those emotions that we see externally in meltdowns. And what he has shared with me is that he finds that he's shut down a lot of the time in retirement. And I think you add COVID on top of that and you've got a whole separate issue going on. But he has really shared some of the challenges with, coming to this identity late in life and reconciling with his relationships with his wife and with his children, and some of these things that he's looking at through a new lens. It's been interesting to explore. I would love to do or see at least some research on the older adult community, and particularly those who just, there was no mention of this when these people were children. And it's interesting to see how they process that. But I don't have any resources to share other than some conversations.
That's great. It's another, Logan put in the chat books from Microcosm. I don't know what that is, but there's some links there. If people want to check that out.
It looked like somebody was physically putting a hand up. Is that?
Oh, yeah. Sorry. Oh, yeah. Kay, are you?
Yes. As a psychologist, I've written many letters to physicians for hormones and surgery, and I'm a senior person, and I've done this for decades. And I'm interested in the psychotherapy aspects, because I think even in the psychotherapy conferences I go to, and I've been to some that are international and all around, but not during COVID, I find that so much is focused on the difficulties of being either autistic or gender orientation, variety on the rainbow, that there's so much about problems, and that people treat much of their therapy as a problems. And that's been a complaint with adult clients I have, that they're seen as, you know, you must have many, many symptoms. You must have many, many problems. And yes, there are challenges with being any minority in our culture, but I think it's difficult to find, and it would be wonderful no matter where a person with these situations meets any professional, that if we ask, what do you really like to do? What fulfills you? What is fun for you? It's something some people have never been asked. And I wonder if you bump into that, because they often see their conditions as only a problem to others, and sometimes their family has been a problem for them with that. Some families have been very protective of the autistic child, but extremely rejecting when that child was not copying the parents' heterosexual norm. So I just wondered if you have any comments on therapy with people that are dual individuals.
That's such a great question, and I just appreciate your thoughts on it, because I think it's largely what I've been hearing as well. And as a researcher, I think that's a huge reason we need to start having autistics on our research teams, because we need to have people that can, you know, show us some of the other side of things. And I find myself, you know, we talk about these strengths-based models, and then when you get to the nitty-gritty, the themes, my themes are pretty deficit based, and that tends to be where we head in the research and clinical world. And I think, to your point, when we're looking at therapy, I think, to me, what I've heard from people is when they are presented with a strengths-based definition of autism, it can be transformative in how they view that part of their identity.
Yeah.
And when they see that, you know, yes, these are some of the great traits that I have, you know, it can help them with building a resume, it can help them with finding a partner, and it can help them with that self-love and self-acceptance piece to say, I'm really good at being a loyal friend in any circumstance. I'm really good at those small details that other people miss. I find them, and I'm really good at that. And I think that extends as well to the LGBTQ piece. And that's where I found the Atwood and Gray definition so interesting. Is I think this intersection does play at people's strengths of autism to recognize that their whole identity is a spectrum, their gender identity is a spectrum, their sexual identity is a spectrum. And I think autism can give people a clearer lens to not be tied into these black and white boxes of male, female, heterosexual, not heterosexual. I think it allows people to really explore, who am I and who do I like and who do, you know, I think that opens up opportunity. And I think it's exactly what you're saying. When we can help them not just address the problems, but start to explore the strengths, I think it can give people a lot of power. I'm not sure that answers your question, but
No, I agree with you. Even gay and straight and bi are rigid categories. And some people say, but I can't, I've been with a man, now I can't go back to my lesbian group. They are talking about me, I'm being rejected. And so any of that polarization is so painful for us.
And I think that's where I found it really interesting to give people, you know, we like categories in research. We like to be able to check people in the box and say this percent or this and this percent or that. And I found it fascinating to give people the open-ended box to say, you know, tell me about your identity. And the terms that people used are terms I never would have put on a closed-ended short list of identities. And instead it gave them space to tell me who you are, instead of me checking what box you're in. And I think when we can, I think it's a strength of qualitative research, and I think it's a strength of qualitative clinical as well, when we can be open-ended in our approach and give people the space to tell us what's important to them. I think that can be helpful.
Jeremiah put a note in the chat about a new book written about neurodiversity that speaks to our role in the worlds of psychology and psychiatry and exploring strength-based perspectives. You can click on that if you're interested.
Thank you. I don't think I've seen that one.
Yeah. All right, it seems like the questions are winding down. If you want to ask more, please raise your electronic hand or stop me from wrapping it up. Just want to say thank you very much, Dr. Lewis, for a wonderful talk. So much to think about, so much to raise our attention to, and good luck with your work. We hope to see you around here and collaborate in the future. And sorry about the Zoom applause, but thank you for a wonderful talk.
Thank you very much. Thank you for having me.
All right. All right, I'm going to end this thing. All right, see you later.